The shotgun was raised only a few feet from his face when the trigger was pulled. The blast exploded outward in a deafening roar, tearing through flesh and bone with such force that everyone in the room assumed Jerry Nave was dead before he hit the ground. His jaw was obliterated. Teeth, bone, and tissue were blown away. The lower half of his face was gone, and the force of the blast fractured his skull so badly that parts of his brain were exposed. Blood flooded the floor. No one expects a human being to survive that kind of wound. Jerry did. When paramedics arrived, they did not expect to find signs of life. Shotgun wounds to the face are almost always fatal, especially at close range. But Jerry was still breathing, barely. His pulse was weak but present. His injuries were catastrophic, among the worst trauma doctors would later say they had ever seen on a living patient. He was rushed to the hospital as emergency staff prepared for a fight they believed they would lose. The shooting was not accidental. Jerry had been living on the streets of Los Angeles, trapped in addiction and homelessness, moving through a world where violence was common and life was cheap. On Skid Row, disputes escalate fast, and mercy is rare. The shotgun was fired with the intent to kill. The only reason Jerry survived the initial blast was the angle of the gun and a fraction of a second that altered the path of the pellets. Inches made the difference between death and survival. At the hospital, trauma surgeons worked against the clock. Jerry's airway was unstable. Swelling and bleeding threatened to suffocate him. His face no longer had the structure needed to support basic life-saving procedures. Doctors had to improvise, inserting tubes where anatomy should have been, stabilizing shattered bone, and removing fragments that threatened his brain. Infection was an immediate danger. The exposed tissue left him vulnerable to complications that could kill him within hours. Jerry survived the first surgery. He survived the second, and then he survived the night. When doctors assessed him the next day, the reality of his injuries set in. He had lost most of his jaw. His mouth was gone. His ability to speak, eat, or breathe normally no longer existed. Large portions of his face would never be reconstructed in the way people imagine reconstruction. Even survival carried a grim prognosis. Doctors warned that infections, brain injury, and organ failure were all likely. Survival was no longer a milestone. It was a daily gamble. Jerry remained unconscious for an extended period. Machines breathed for him. Tubes fed him. His body was kept alive while surgeons planned what little could be done next. When he finally regained consciousness, the pain was overwhelming. He could not speak. He could not communicate except through writing and gestures. When he eventually saw his reflection, the psychological shock was as severe as the physical damage. Reconstructive surgery began slowly. Surgeons harvested bone from other parts of his body to rebuild fragments of his face. Skin grafts were placed to close wounds that could not heal on their own. Metal plates were installed to provide structure where bone no longer existed. Each procedure carried risk. Infections forced repeated surgeries. Progress was often erased by setbacks that arrived without warning. Learning to eat again took months. Jerry was fed through tubes long after most patients would have transitioned to food. When eating was reintroduced, it came in careful stages, under constant medical supervision. Speech therapy followed, forcing Jerry to relearn how to communicate without the anatomy he once relied on. Every sound required effort. Every word was work. Progress came painfully slowly. The emotional toll was relentless. Surviving a shotgun blast to the face meant Jerry could no longer hide from the violence done to him. His injuries were visible. Strangers stared. Some recoiled. Others asked questions they did not realize were cruel. Children reacted with fear. Adults avoided eye contact. Jerry had to learn to exist in a world that constantly reminded him of what had been taken. For a long time, addiction still had a grip on him. Recovery from trauma does not erase old demons. But surviving something so extreme began to change the way Jerry saw his own life. Doctors and nurses who treated him were stunned not only by his survival, but by his refusal to quit. Many patients with far less damage give up. Jerry did not. Years passed. More surgeries followed, more therapy, more pain. Gradually, Jerry regained functional speech. It was not the voice he once had, but it was a voice. He learned adaptive ways to eat, to communicate, to live independently again. He began sharing his story publicly, not to inspire pity, but to show what survival actually looks like when it is stripped of romance. Doctors later described Jerry's case as extraordinary. Shotgun wounds to the face almost always kill instantly. Survival alone is rare. Meaningful recovery is rarer still. Jerry's survival was the result of anatomy, chance, medical skill, and an unwillingness to die even when his body had every reason to stop. Jerry Nave rebuilt a life from fragments. His face tells the story of violence, but also of endurance. He is not the man he was before the trigger was pulled. No survivor ever is. But he is alive. And every day he lives is proof that even injuries meant to end a life do not always succeed. After leaving the hospital, Jerry's recovery did not suddenly become easier. Medical survival did not mean functional survival. He faced a long stretch of unstable housing, follow-up surgeries, and daily limitations that most people never experience. Eating remained slow and exhausting. Infections returned without warning. Scar tissue tightened and had to be cut away in additional procedures. Every improvement carried a cost. Speech therapy became a routine part of his life. Without a traditional jaw structure, forming words required deliberate muscle control and constant repetition. Conversations that once took seconds now took minutes. Being understood was not guaranteed. Misunderstandings were frequent and frustrating, but Jerry continued anyway, rebuilding communication one sound at a time. Public reactions were often harder than the physical pain. People stared openly. Some reacted with fear. Others asked invasive questions without hesitation. Jerry learned quickly that surviving extreme violence meant carrying visible evidence of it forever. There was no anonymity. There was no forgetting. Every public interaction became a reminder of what had been done to him. Psychological trauma followed him just as closely. Nightmares replayed the moment of the blast. Sudden noises triggered panic. Counseling became as necessary as surgery. Recovery was not a straight line forward. There were relapses, both emotional and behavioral. Addiction does not disappear because someone survives the impossible. What changed was Jerry's willingness to keep going despite setbacks. Over time, his story reached medical professionals, social workers, and journalists. Doctors used his case as an example of extreme trauma survival. Surgeons referenced it when explaining the limits of reconstruction and the rare exceptions to fatal outcomes. Jerry became known not because he wanted attention, but because his injuries demanded explanation. What made his survival different was not just that he lived, but that he continued to function. He learned how to navigate a world that was not designed for someone with his injuries. He adapted his routines. He accepted help when needed. He rejected the idea that survival meant hiding. Years after the shooting, the damage to his face remained obvious, but so did the determination behind it. Jerry did not regain what was lost. No reconstruction could offer that. What he rebuilt instead was a life that acknowledged the violence without surrendering to it. Thank you for listening to Horrifying Survival Stories. Subscribe for more stories of those who faced the impossible and lived.